Welcome to this webinar on digital health during public health emergencies. I welcome you from the Palais des Nations in Geneva, Switzerland. My name is Alex Mejia. I have the privilege of being the division director at UNITAR, the United Nations Institute for Training and Research, co-organizing this interesting webinar. Before we begin with proceedings that I am sure you are going to find very interesting, I simply wanted to offer an introduction from the general to the specific on why digital health becomes more and more important during these very uncertain times. And just to give you a seminal idea, I hope, we all know that the current pandemic, since our colleagues at the World Health Organization, and you are going to hear from some senior officials there, since they declared this a pandemic, everyone, I do remember, was pretty sure that the situation will get bad, but perhaps in a couple of months, maybe 6 months, it depended on the scenario, the situation will ease and we will move on. That, of course, and WHO has been warning us consistently and correctly, that has not happened. So since mid-March, I do remember when I have the numbers stuck in my head, when we had 165,000 cases, 15 March to be exact, to yesterday, when we had 37,601,000 cases, the difference is abysmal. And this has forced us to understand what is the role of public health institutions, what is the role of government as a whole, and what is our particular role, what we should do as common citizens in trying to do our part to protect our societies, the communities that we are part of. And I can tell you that regardless of the analysis, regardless of how you see it, the fact of the matter is that the most vulnerable are even more exposed today. And that is indeed something regrettable. That is indeed something that should not be put aside. But there is always this dichotomy, you remember, between the urgent and the important. The urgent, of course, is to protect lives of those infected with the coronavirus, to actually save people that are in intensive care in hospitals around the world, and to prevent anyone from becoming infected with this very pernicious virus. But at the same time, and that being the obvious for health systems, there is this other reality of what is important, but perhaps a little less urgent. And that it's a pity, because what we have seen, and you're going to hear later on, is that the services, the public health services in most of the countries, no matter how developed or underdeveloped your country is, and how capable or less capable your public system, health system is, the fact of the matter is that this other side has been put on a secondary back burner priority. And that's a mistake. And that's a mistake because we are going to suffer the consequences. We are already seeing the results of that, just to give you examples of why surgical care has been perhaps postponed to dedicate ourselves, as I said, to the origin, in this case, the COVID, or why prevention care has always decreased, and as a whole, how health in our societies is today in a more precarious state. I tell you that to give you a perspective, at least from us at the United Nations, in particular at UNITAR, why public health systems are to be protected in a holistic manner, how they should be supported, perhaps empowered with the resources that they need to fight the coronavirus, and the other rest of the public health spectrum as a whole at the same time. A very difficult balance to achieve. We at the United Nations would like to see development as a whole and the well-being of our societies in a holistic manner. That's why member states, it wasn't us, we were simply the facilitator, in September 2015, enacted, adopted at the General Assembly that year, 5 years ago or so, the Sustainable Development Goals as part of what we call the Agenda 2030 for Sustainable Development. Some of you know that, some of you don't know that. And today, just to conclude, I would like to invite you to learn a little more about what we call the SDGs, Sustainable Development Goals. Why? Because this is the second phase from 2016 January until December 2030. It's the second phase of a roadmap for global development. In this particular case, there are 17 Sustainable Development Goals, and number 3 is dedicated to health. But health is also important in other of the 17 goals. And I invite you to learn a little more, because we have to maintain this holistic view of our nation's art to progress, how we have to protect the vulnerable, how we have to reduce exposure to those that cannot care for themselves. So in this short introduction, on behalf of UNITAR, the United Nations Institute for Training and Research, I thank you for joining us today, and I very much look forward to hear from the experts on why digital health remains a priority for our health systems worldwide, and particularly during these health emergencies. Dr. Danny Shi, who leads the digital health portfolio at UNITAR, quite a privilege for us, is now going to take over and to introduce the panelists after some welcome remarks as well. Danny, the floor is yours.
Thank you, Alex, and thanks for the excellent opening remarks and for framing the discussion so nicely. I think you really highlighted why it's important that our digital health response to the pandemic is robust in order to protect the entire health system. I would also like to echo your words in welcoming all of our participants to this third episode of the Responsible Digital Health Speaker Series. And I would like to remind everyone joining us today to please feel free to use the Q&A function on the Zoom to submit questions throughout the session, and we will try and address as many of those questions as possible at the end of today's discussion. The subject of today's sessions, as Alex has already mentioned, is digital health during public health emergencies. And it's quite a relevant one, given the current situation around the world that we're all living through. The application of digital tools to respond and manage to outbreaks is not a new concept. However, the ongoing COVID-19 pandemic has certainly brought it more into the mainstream. This pandemic alone has sparked the development of over 1,000 digital health tools or applications produced in an effort to control the outbreak. Many of these tools will be effective weapons in our arsenal to battle this deadly disease. However, great care must be taken to ensure that the responsible development of these tools, else we risk a litany of potentially undesirable side effects, some of which we have already covered in the series, more of which we will hopefully cover today and in subsequent episodes in this speaker series. Today, we are joined by 2 excellent expert guest speakers, both of whom have hands-on experience responding to past infectious disease outbreaks, as well as, of course, the current COVID-19 pandemic. Our first guest today is Dr. Patricia Ndumbi. Dr. Ndumbi is an epidemiologist and scientist at the World Health Organization, supporting public health initiatives at national and international levels. Dr. Ndumbi was a health information team lead and field epidemiologist with the WHO during the Ebola outbreak in the Democratic Republic of Congo, and prior to joining WHO, worked with the European CDC and Médecins Sans Frontières. Dr. Ndumbi, thank you very much for joining us today and welcome to our webinar series. The floor is yours.
Thank you, Danny, for giving me the floor, and good afternoon, everyone. And today's presentation, I will talk about how digital solutions can help manage and contain outbreaks. So next slide. So in this presentation, I will cover the following topics, essentially how I will discuss current challenges in disease outbreak surveillance and response. I will provide examples of digital solutions that are used in public health emergencies. And I will also give a brief overview of digital proximity tracing applications, which is an emerging technology that was developed during the COVID-19 pandemic. Next slide, please. Thank you. So when an outbreak starts, if it is not contained rapidly, it can spread exponentially and become unmanageable. This is why it is important that countries have surveillance systems in place that can allow them to rapidly detect outbreaks and respond to them while they're still manageable. And under the international health regulations, next slide. Under the international health regulations, WHO is mandated to support member states to build adequate surveillance systems that can help them detect, assess, and respond to outbreaks in a timely manner. Therefore, surveillance is one of the highest health priority for both WHO and its member states. And the COVID-19 pandemic has re-emphasized the need to better streamline and enhance national surveillance activities, as well as to improve data harmonization and sharing. Next slide. Thank you. So public health emergencies typically create increased demands for accurate data to be collected and shared rapidly, pretty much in real time. And this is for informing response activities. However, the data landscape is often complex and fragmented. And let's take, for example, the example of COVID-19, where we have to collect data on alerts, on contact tracing, surveillance, case management, laboratory, etc. So these data sets should be interlinked and integrated, but it's not always the case. Within a single country, you can have multiple tools that are used to collect different types of data, which are then stored in different types of formats and data sets. Next slide. So as a result, some of the key challenges we encounter in disease surveillance include the fact that surveillance platforms and tools are fragmented. There's a lack of high quality data and limited data sharing. There is a lack of data standards and interoperability between platforms. And in terms of capacity building, like the health workforce tends to have limited digital skills. Finally, it is not always clear for government which solutions they should prioritize because many do not have access to a solution inventory or to a list of vetted solutions, for instance. Next slide, thanks. So on this slide, I'm presenting some of the most commonly used tools in outbreak response globally. Please note that this is not an exhaustive list of tools. The light blue tools are tools that have been developed by WHO, and I will provide a brief overview of some of them later in the presentation. During the COVID-19 pandemic, new technologies such as digital proximity tracing have also been widely adopted by member states to support contact tracing. And I will provide a brief overview of these later as well. Thank you. But prior to this, I would like to emphasize the fact that it is not enough to have the right tools. We also need to have the right environment for these tools to be implemented effectively. So in order to ensure that countries can get the most benefits from these solutions, several factors need to be taken into account. For instance, we need to assess the digital maturity of the country, ensure that data systems are interoperable, ensure that the health workforce is trained on how to use those tools, etc. So essentially, there is a broader environment that the tools are being introduced to, and this needs to be taken into account. As WHO, we guide and support countries to adequately implement digital solutions, taking into account their specific enabling environment and context. In the next few slides, I would like to give a brief overview of some of the tools that were developed by WHO to support outbreak response in countries. The first tool I will introduce to you is EOS. And this is a community of practice dedicated to public health intelligence, and it uses several systems to monitor and screen the media or publicly available information in order to detect signals of potential public health events. And this process is referred to as event-based surveillance. By doing so, EOS facilitates timely detection, assessment, and notification of outbreaks. This is the tool, for example, that we used to help us detect the initial signals that we received about the COVID-19 outbreak in China. Next slide. Great. Then we have EWARS. EWARS is a smartphone-based early warning surveillance system. and that allows health facilities to report information in real time. This tool was initially built for emergency contexts, such as conflicts or natural disasters, where the existing national surveillance system is disrupted or inexistent. So EWARS is essentially an easy and simple way to provide, to rapidly set up a surveillance system, regardless of infrastructure challenges. So this tool is also very suitable for resource-limited settings with low connectivity because it allows for offline reporting, and the kit also includes a solar battery, which allows it to function in the absence of electricity. And one kit of EWARS includes about 50 phones, which can support up to 50 health facilities and cover around 500,000 people. Then we have GoData, which is a field data collection platform, which focuses on collecting data on cases such as laboratory data, hospitalization data, or other variables that are included in case investigation forms. And it also collects data on contacts, mostly contact follow-up data. And it helps generate a visualization of transmission chains. So GoData can improve outbreak response in several ways, including by improving the timeliness and completeness of outbreak investigation data, and by improving access to case and contact data, and automating and improving data visualization, analysis, and reporting. And it also reduces the number of disconnected data sets. So WHO and GORN partners are supporting GoData implementation in around 60 countries worldwide at the moment. And this includes virtual trainings and technical support around epidemiology, data analytics, interoperability, and also general IT issues. We also have developed 2 platforms to help governments prioritize and monitor their digital solutions. One of them is the Digital Clearinghouse. This was launched a couple months ago, back in the summer. And this is essentially a platform that allows countries to have access to a repository of WHO-vetted solutions. So solutions will be submitted to the Digital Clearinghouse, and they will be evaluated by an external panel of experts. Then they will have another round of evaluation internally, and then that will be included in the Digital Clearinghouse. We also have developed a digital atlas, health atlas. So previous slide still, sorry. Can you go back? Thank you. We also developed the Digital Health Atlas, which is a global registry of digital tools implementations in the world. Next slide, thank you. So here, I just wanted to highlight the fact that in addition to developing digital tools to support countries, WHO is also developing competency-based frameworks for digital health workforce strengthening, as well as digital course training for people involved in the governance and implementation of digital tools. Next slide. So finally, I would like to give a brief overview of digital proximity tracking tracing applications. These applications are designed to alert people that they have been exposed to someone who tested positive for COVID-19. So most of these applications do this by using a Bluetooth technology that records digital handshakes between devices based on distance and duration criteria. So this application can greatly improve timeliness of contact tracing processes, which can eventually help in controlling further transmission of the disease. However, it is important to note that these applications are meant to support and not replace conventional contact tracing, and therefore they should only be implemented within the context of a comprehensive contact tracing strategy. Next slide. Next slide, please. Thank you. So on this slide, I'm not going to go too much in details, but I just wanted to list a few. Can you go back one slide, please? Thank you. So here I just wanted to go over a few considerations that countries should take into account when adopting digital proximity tracing solutions. First of all, like in terms of technical requirements, so are the technical characteristics of these applications in line with digital principles? Are the codes open source? Are they compliant with data privacy regulations? Are they interoperable with other apps? And also just in terms of the environment they are introduced in, is it a suitable environment in terms of adequate digital governance, technological infrastructure, regulations on data privacy? And what about the ethical considerations that should be taken into account in terms of data minimization, data use restrictions, limited data retention, or equity and inclusivity? And finally, there's also the issue of understanding whether those apps are actually effective from a public health perspective. And if so, how can we measure their effectiveness? And this is something that currently we're really struggling with, because we're trying to balance between individuals' trust and privacy and the ability to collect data that can actually inform public health response. So overall, WHO has been developing several documents to guide countries through these different implementation considerations. And we are currently jointly working with the European Center for Disease Control to develop a KPI framework to help us, to help countries assess the effectiveness of their digital contact tracing applications. Next slide. So here I just wanted to quickly highlight that although my presentation mostly focused on outbreak detection and response, digital tools are supporting many other aspects of public health emergencies, including telemedicine or supply chain management, for instance. Next slide. So early surveillance, testing, contact tracing, and strict quarantine are critical for COVID-19 pandemic response. However, like the manual processes that we used before are breaking down in the context of COVID-19. So the scale of coordination and data management required for effective implementation of these strategies requires adoption of digital technology and its integration into policy and healthcare. So while digital tools are increasingly being used in public health emergencies, there are significant challenges that we must address that in terms of data privacy, of data availability and analysis. And solutions such as data aggregation, data anonymization, and decentralization of data processing could help address some of these privacy issues. Next slide. Thank you. So here, I just wanted to take the opportunity to invite you all to the official launch of the Digital Implementation Investment Guide. So this is essentially a document that provides an operational approach for planning digital health investments that are aligned with countries' national health priorities and that is really adapted to the country-specific contexts. So this will be launched tomorrow at 3 p.m. Central European Time, and you're more than invited to attend. Next slide. And here I would like to just acknowledge all the colleagues I work with that have been involved in many of the projects that I presented during this presentation. Thank you for your attention.
Thank you, Dr. Ndumbi. Excellent presentation and excellent outline of some of the requirements for robust digital health tools for responding to pandemics, but also some of the challenges that we face, and I look forward to exploring some of those in more depth later in the session. I'd now like to move on to introducing my second guest today, His Excellency Dr. Bandar Alkanawi. Dr. Alkanawi is the Chief Executive Officer of Ministry of National Guard Health Affairs in Saudi Arabia, a publicly funded, large and integrated national clinical academic healthcare system providing integrated care to over 2 million Saudi Arabian National Guard personnel, their dependents, and the eligible local population. Dr. Alkanawi has also been president of the King Saud bin Abdulaziz University for Health Sciences Saudi Arabia since 2009, and among a long list of career achievements, including the implementation of a large-scale electronic health record system and the formation of an international research center, Dr. Alkanawi is serving as the president for the Riyadh Global Digital Health Summit, a G20 associated event that envisioned global health system connectivity in preparedness and response to the COVID-19 pandemic. Dr. Alkanawi, thank you for joining us today and welcome to the series. The floor is yours.
Thank you, Danny. Thanks, Alex, as well for the nice introduction and beginning of the presentations and for this webinar. And I'm really pleased to, can I have my first slide, please? Just to give an overview, we had a very, very well attended summit early in August, and it really talks about, or it actually centers around the role of digital health in fighting current and future pandemics, and was largely attended by global attendees, and was really quite an event that we had. For the summit, we had really a lot of professionals from different parts of the world who were academic, people in governmental offices, and as well researchers in private and governmental institutions. So it was really a mix of very high professionals in the field of public health and of course digital health in general. So I will just have my introductory slide, please. I think, wanted just as a group to look at this as digital health should enable and empower people as well as health and care systems to prevent and treat communicable and non-communicable disease and sustain wellness. So I think that was a very overarching principle that we wanted to really make sure that this is well managed and well understood. I think we all know that inequalities in digital health capabilities and access are experienced at individual, local, national, and global levels. And this is usually hindering into the inequities and as well reduce the issue of embracing digital inclusions. So the digital divide or digital exclusion is really something that we all have to be quite aware and be able to plan for it in the future. Next slide, please. Out of the summit, actually, the Riyadh Declaration, which was published at the Lancet recently, talks about its role in the role of digital health, and basically it calls for an action to create infrastructure that shares good digital health evidence-based practices. And as we mentioned by Patricia, real-time, high-quality data is really important at global, local, and global levels, and that's something that all of us should enable more health system and countries to have an actionable insights once we have all of this in place. Again, digital and data technology will promote coordinated development of shared global public health policies and resilient health and care systems in order to perform better in future pandemics and other healthcare challenges or health challenges. Next, please. The summit actually developed key priorities, and there are 6 of them. And I think the first which comes to mind is crisis and risk communication, health data, governance, quality policy and regulation, and its use in practice, and as well establish applied health intelligence. Adoption of interoperable digital technology, scalability and sustainability is very important. In addition, that enhance the quality and effectiveness of digital technology for improved patient and population outcome. Quite importantly as well, research and innovation. I think throughout the COVID-19 pandemic, we have noticed that a significant amount of research is needed in order to really develop. Actually, you can see the development, Patricia has highlighted few technologies for tracing and many others that has been developed, not only at the technology side, but as well in the healthcare and healthcare management of patients. So again, these are very, very important that we need to enhance and make sure that we innovate as we go along. Recommendations that's been as well been addressed. Effectively implement data-driven evidence-based protocols for clear and effective communication. I think communication has been an important issue between different parts of the world, and really having this as stream without any hiccups is quite essential in order to be able to develop clear a clear reaction or clear response to this. I think common messaging, I'm sorry, go back please. In order to build the citizens' trust, I think it's very important to have this communication very clearly understood, and as well reach out to the front line and to the global people as it should be with an evidence-based practice. Next. I think we need to really make sure that we confront mis and disinformation propagation. And this is really very essential in order to really gain the trust of populations and citizens, and ensure that whatever evidence-based and research and really well from trusted authorities and trusted agencies is well communicated, and to really combat or confront whatever being presented throughout social media platform and as well mass media. So this is a global need and a global action, and I'm pleased that many countries and as well the WHO has really pioneered in trying to really make sure that first-hand information received from the real and the right professionals. As well, establishing standard global minimum data sets for public health data reporting, as well as data governance structure tailored specifically to communicable disease. I think all of us agree that without having this and able as well to communicate it with a good governance globally, I think we will not be able to be ready for any future health challenges, specifically in pandemics and many other outbreaks. Ensuring that countries have established priority in relation to data and digital health, in particular, the digital health maturity and infrastructure. I think, again, these are important principles that we need to, all of us, work and make sure that we're all ready and supported throughout different NGOs, supranational agencies, to ensure that as well we develop maturity and as well ensuring infrastructures are available. Enabling health and care organizations with the necessary technology to transform high quality, timely data collection and sharing for applied health intelligence. I think, having data is really good. Quality data, of course, as well timely data is very important, but trying to develop health intelligence with outcome and measures of needed deliverable and actionable recommendation is very important. So I think health intelligence comes here as an essential component of public health response, digital public health response. Again, Patricia as well highlighted the importance of skilling workforce in healthcare and healthcare organization, as well as social care, because I think these are the areas where weak points and has developed maybe a risk to different countries where home health care or nursing care systems has been probably not well prepared or not ready for different ways of reporting these risks. So having them with the skills, knowledge and training and data and digital technologies are required to face current and future public health challenges. Ensuring surveillance systems combine an effective public health response with respect to ethical and privacy principles. I think there are lots of discussions about this part, and I think the balance between sharing public health, important public health data, and ensuring that we respect the ethical and privacy of citizens is quite essential. And this debate is going to continue. However, we need to make sure that we are balancing this in order to combat pandemics and the risk of pandemics. Last but not least, I'm sorry, there is one slide more. Develop digital personal tools and services to support comprehensive health programs, disease prevention, testing management, and vaccination program globally. I think these are very important, particularly for travel and easy travel and working around in transportations. These are very essential to be able to have a digital tool that as well can facilitate this and ensure that we do not have any people who are spreading infections somewhere else. As I said, last but not least is maintain and continue to fund and innovate surveillance data systems. I think after pandemics, hopefully in the near future that this can go down, I think we need to maintain our vigilance, maintain that we continue to fund whatever developed surveillance data systems globally as a core part of connected global health system for rapid preparedness and optimal global response. I think this slide is so essential that we maintain our guards are high and very alert system are available, as we have seen how much COVID has resulted in major disruptive of our life. This viral war has been something that all of us have learned to be able to be ready and prepared throughout systems. Okay, thank you very much.
Thank you, Dr. Alkanawi, and thanks for the excellent presentation. I'm very pleased to see that you highlighted some of the issues already raised by Dr. Ndumbi, including the need for quality, timely, and interoperable data, but also raising some new points there, particularly with regards to the spread of misinformation and building trust within communities, which I think are essential for ensuring we have an impact in our response. I'd like to transition now into the Q&A portion of the discussion. So Dr. Ndumbi, allow me to start with my first question for you, if you will. I'm sure many of our participants joining us today and who are following the whole series are very interested to know the position of the WHO in relation to digital health priorities generally. So I'd take the opportunity with my first question just to ask you, what has the WHO identified as its biggest priority areas in digital health, obviously particularly those related to the ongoing pandemic?
Thank you, Danny. I think there are several important areas that we should focus on. For instance, leveraging frontier technologies such as artificial intelligence to strengthen predictive analytics. Also like building capacity for health workforce but also for health seekers, because now a lot of the digital applications that are out there are targeted to health seekers and they're not always, they don't always have a high level of digital literacy. There's obviously the importance of establishing interoperability and standards given the multitude of tools that are available out there. And we need to strengthen governance of these digital tools, not only during this pandemic, but also after this pandemic. Like, what do we do, for example, for digital proximity tracking applications? Like, how are they going to be handled once the pandemic is over? So this is a very important issue we need to also look at. And we get a lot of requests from countries regarding support for telemedicine, for instance, as well. So those are some of the, it's not an exhaustive list, but also some of the key areas that we're really focusing on right now at WHO.
Excellent, thank you. And I think it's important to mention, actually, as you did there, that not all digital health tools that are relevant for public health emergencies are those that are directly responding to the emergency itself. I think telemedicine, we've seen the importance of that grow massively during the COVID pandemic. So I think it's great to highlight that. And I think you've raised some issues there associated with digital health technologies that are very new. And so we don't really have a basis on which to base, how we develop these tools. And I think that brings me nicely on to my first question for Dr. Alkanawi. I understand that you were heavily involved in the response to a previous coronavirus outbreak, one back in 2012 and 2015. Of course, talking here about the Middle East Respiratory Syndrome coronavirus, or MERS-CoV. I would like you to reflect on what are some of the big differences in terms of the availability and utilization of digital tools to manage and respond to that coronavirus outbreak compared to the one we're currently living through. And given the advancements in digital health solutions since 2015, in your opinion, were we any more prepared to deal with this COVID-19 outbreak than we were for MERS? And if so, how much of a role did digital health have to play in that preparedness?
Thanks, Danny. Definitely, MERS was an issue. We had the big outbreak, not as many as COVID, of course, with MERS in our healthcare system in 2015, actually in August 2015. And clearly, that has resulted in us, closing our system, in Riyadh. And for that, we have to divert patient. We have to work around helping these people who got infected and all of this. So it got to the preparedness, and I think that prepared the system very well, I must say. People are, went through that major health crisis where we're able to set up, activities related to this. So the workforce were well prepared from skill of infection control practices. So we have really limited, for example, transmission of the infection during COVID now between our healthcare providers, very limited, I must say, and compared to, for example, to MERS when it happened. With regard to digital technology, I think we were very ready, for example, with telehealth, very clearly. We're able to reach to our patients who are being not able to be seen. In addition, we were able to develop more applications during COVID for monitoring patients and for patients who are not needing hospitalization. How do we, work around with them and monitor them at home and be able to reach them? Very much easier than when it happened with MERS. So I think the maturity of the system, I think, as a foundation was great. And when COVID occurred, we were able to utilize this quite efficiently and upgrade them and innovate in using them much easier. For example, delivery of medications, able to communicate with physicians and healthcare providers, and the emergency room was quite substantial. As well as, I think, the issue of critical care. I think that as well helped us in our critical care because of the infectivity of this coronavirus. Our healthcare provider interactions with the bedside care as well has matured and developed in a better way. And I'm really pleased to say that between our workforce in critical care units and emergency room, we had almost no transmission of the virus during COVID outbreak.
Excellent, and hopefully that serves as a lesson for all of us. Hopefully this terrible pandemic that we're all living through will at least lead to this advancement of digital health initiatives and the capacity to, transition to telemedicine and e-health when the situation requires it. And I think the Riyadh Declaration that you and your colleagues have published and the vast amount of work that WHO has done in response to this pandemic will be sort of leaders in that transition. Dr. Ndumbi, I'd ask you another question, if I may. So what are some of the biggest challenges that still remain to the application of digital health during an outbreak response, and how can we start to overcome these now?
Well, I guess some of the key challenges include, for example, connectivity. I think about 49% of the world population is not connected to the internet. So how do we implement this, those digital solutions without exacerbating the digital divide and, including those disenfranchised populations? And maybe one of the way we can approach this is by creating partnership with various actors, including the private sector, to improve access, but also with the International Telecommunication Union, so the ITU, to engage with them and with operators to improve connectivity in different governments. Another challenge is also the low level of digital health and literacy among certain populations, and we need to remediate to that. And one approach, or several approaches, could include investing in remote digital learning and in partnerships with academia and in developing accredited courses and certifications in digital health. And another issue is also in the deployment of some of the tools that we found. Like, of course, we can't predict outbreaks, and sometimes, well, not always, and sometimes countries are not prepared when they are facing an outbreak and they have a tool that is presented to them for implementation, and this tool is not necessarily mature enough and or do not have an established user base or proper supports that's provided to the people that are going to use it in case of technical difficulties. So this really creates like an extra burden for the countries to have to run such tools in parallel with their existing systems. And one thing we could do is to make sure that we have established networks of trained users for those tools that are developed outside of an outbreak context. And so that countries have this digital preparedness already in place before outbreaks occur.
Absolutely agree, and UNITAR and our division in particular is willing to take our position in this role and help build this training capacity as well. You mentioned there the importance of public-private partnerships in improving this capacity, and I think it's essential, but it will naturally ring some alarm bells in some people's heads with regard to data privacy and data governance. And Dr. Alkanawi, if I may, thinking here about data privacy and governance during outbreaks and the trade-off between privacy and timeliness, and you kind of alluded to this in your presentation as well. When, if ever, is it okay to use personal data without our permission? Does the government or health authority ever have the right to use our data during an outbreak without explicit consent? And ultimately, when does this public good outweigh personal privacy and personal rights?
Well, that's a very good question. At the same time, difficult to answer in this limited time. However, I think we always should have a balance, between privacy and as well the importance to protect others. I think it's a global responsibility, of course, the citizenship responsibility of protecting ourselves and others, And I think finding this significant debate is going to be a difficult part, and I don't think we will have an answer. And I think this is something that is globally and between governments and populations is going to be a main issue to do that. However, I think we want to make sure that as well as part of responsibility from our side, that individual responsibility, that sharing data and sharing data, particularly in this particular things, is I think sharing is caring. So it is a personal responsibility to be able to share the data, and of course, finding the balance, I think, is quite essential. However, how to enforce this, I think, again, I'm not probably going to be the expert in answering this significant part of this debate. However, we all understand that trying to be part of public health combatment or preparedness is to ensure that data at an individual and local level, national level, and global level is important to be shared.
Mm. And I think, sorry.
And we have to continue really driving this concept and ensuring that it is accepted everywhere.
Yeah, and I think it also comes back to this piece about having training and education in place. If people realize what they're sharing their data for, they need to know exactly what it is their data is being used for and how it's being used. So that's our responsibility to train them and improve digital literacy, to know exactly how data is being used. Dr. Ndumbe, I'll come back to you for a final question, I think, and then we'll move to asking the audience a few questions from the audience. Sorry, I understand that Go Data was developed in response to this need for robust data during outbreaks that both yourself and Dr. Alkanawi have highlighted in your presentations, particularly related to cases and contact tracing. But I was wondering, how do you adapt this to more resource-limited settings where connectivity and even electricity may be very unstable?
So I think Go Data is a tool that it's really been designed for the field. So it's been designed in a very flexible way to adapt to different outbreak scenarios. And so to address your questions about being in challenging contexts with limited connectivity, so Go Data doesn't necessarily require internet to work. So you can have an installation of GoData on your computer, or you can have it on a server. Of course, if it's on a server, you require internet, but you can also just have it on your computer and use it completely without internet. And if you use it on the phone, you can also record data without internet. Of course, you will need internet only when you need to transfer the data to a server. So this is kind of quite adaptable to the different settings, and there's a lot of resources on how to contextualize the use of GoData in different settings in the GoData community of practice that I've created for this. So I can actually put the link on the website if people are interested, on the chat if people are interested to look in more details, because it gets very technical. So I just
Yes, I think that would be excellent. Then those that are more interested can delve deeper. And Dr. Alkanawi, one final question for you then from my side. So we've heard a couple of times today that awareness raising and sharing public health information is key to any epidemic response, but health misinformation, particularly shared through digital platforms and social media, particularly in settings where social media is the primary source of news and information for some people, can obviously cause a great deal of harm. But what can we do to try and tackle the spread of misinformation online and ensure that public health information that reaches people is trustworthy and accurate, particularly in times of pandemic when it's essential that they're getting good information?
I think, organization like WHO, and these big organizations has to really come all the time, have regular release of informations and in different means of social media. The problem with untrusted social media platforms is cannot be controlled. However, I think overcoming them by really us as the real professionals in this field and providing all of this informations and reaching out to through all means, I think is quite essential. And turning into the national organizations, like ministries of health or public health agencies, and all of this, it's quite essential that they will be accessible to patients, and reaching out, I think, is quite essential, particularly during these days with accessibility of digital technologies. So I think nothing better than really competing, or actually maybe more than competing with these misinformations at the level of all levels. And I think having more better than doing nothing, or at least letting that floor to be occupied by unprofessional or people who are really thinking of things that is not there, or making it not essential to be dealt with.
Yeah, I agree, and I think you're right. The WHO has made a great deal of effort, I think, during this current pandemic to really try and do some myth busting, I think they call it on their website, which I think is really great, and it's essential that information is getting to the right people, and as you say, combating some of this misinformation which is being perpetuated. I think we have time for just one or two questions from the audience, and we have a couple of excellent questions. So I think the first one is probably aimed at you, Dr. Ndumbe. Thanks for your presentation. And are you looking into antibodies tests to capture COVID-19 immunity as WHO, I assume?
Yes, I guess, yes, as WHO, we are following different studies to look at seroprevalence of COVID-19 in different populations. But however, I'm not directly involved in this work, so I cannot comment in details. But yes, WHO is coordinating, or at least reviewing several studies looking at seroprevalence, which is quite low.
Yes, yeah, is it surprisingly low, do you think? Would we expect that more people would have been exposed at this point, or is it roughly what you would estimate the exposure to be?
I'm not sure, so I'm probably not going to comment on that here, whether it's surprisingly low or not. But yeah,
I think Something interesting to bear in mind though, and for our participants perhaps, is even if the seroprevalence was high, we still don't know enough about the virus to know what that means for the epidemic long term. You know, we don't know enough about long-term immunity, etc. So I think it's interesting, and I think it's necessary to do this antibody testing and serosurvey, but I think we need to be a bit careful and cautious about how we interpret these results. And the final question before we wrap up today, is cybersecurity a threat being integrated enough in digital health? And Dr. Alkanawi, perhaps you would like to respond to that one.
Well, definitely it is a risk. And again, you know, we, as you know, many of our colleagues who are more expert in technology, really all the time they think about this and keeping this as their first priority in order to ensure that whatever they do is well protected and as well has the best protection that they can do. So again, I think not like firsthand on technology. However, my colleagues in the systems and everywhere, I hear that the cybersecurity is essential for this. And again, that's probably one of these areas that compacting mass information or misinformation is going to be helpful to ensure that cybersecurity will be covered there as well. Mm. Particularly when we have global data, you know, data are going to be shared, and digital tools, personal digital tools for traveling, or all of this is ensuring that it's a secure information is part of this, and part of a good quality data as well.
Mm. Anything to add, Dr. Ndumbe? No,
I think that was a quite comprehensive answer.
Yeah, agreed. I said that it was my last question, but I feel it's important to address this one. Someone has reached out on the chat and said, if we have a digital technology that may help address some of the challenges you mentioned, what is the best channel for a tech company to brief in a timely manner the World Health Organization or an organization like the Ministry of National Guard Health Affairs, I assume, for uptake of such an app or tool? Mm.
Well, on the WHO side, the right entry point would be the digital clearinghouse, which I presented in my presentation. So you would typically basically send your solution, and there will be, we have if you want a list of criteria that we ask about your solution, if it complies with some of them. And from this, it's kind of a baseline entry point into the digital clearinghouse. And from this point, then it's evaluated, and it can then be, if it's approved by the external review panel and the internal review panel, it can then be included in the digital clearinghouse. And this is a platform, like I said before, that ministries of health from all over the world can have access to basically look at WHO vetted solutions. So that's from the WHO side. I don't know if Dr.
Yeah, I think thanks, Patricia. I think it's important, this issue was highlighted a lot during our summit. The issue of, for example, if we look at FDAs are usually have medications, vaccines, and all of this, take care of it. I think we do not have something that is equivalent, or at least close to the issue of approving these issues, these technologies. When we look at, for example, medical equipments as well, there are certain agencies nationally and internationally that controls this. But I think for digital technology, health technologies, I think still it's not at bar. So we need as well to think about similar national systems or national organizations that can control and make sure that these are well evidenced, well researched, and as well have the impact and outcome. So I think this is a very, very important question, and I'm happy that Danny here is and Alex to have this as from an institute point of view and research and training to look at this. Maybe calling for something that as well can regulate and ensure that this issue is covered very well, because people are throwing these different tools and platforms and solutions And I think it's for healthcare, for health and care systems, they need to be reasonably advised on how to select and how to best choose.
Yeah, completely.
Danny, if I may react very briefly, and I know we're running out of time, but I simply wanted to echo what Dr. Alkanawi just said. When I was reading about both of you, Patricia, our colleague, brilliant presentation, really very holistic. But I also read of the impressive resources and network that you have built at the Ministry of National Guard Health Affairs in Saudi. And I wanted to just mention something that I believe is important for, because we have participants listening from several countries, most of them developing nations, in what we saw in the registrations. Digital health, it's really a path forward, we believe, is a path forward to accelerate development. Why? Because the typical model of development, which is not necessarily digital, right? The way we used to do it in the 70s, even in the 90s, is not the right one. For nations like mine, I come from Ecuador in South America. An example, and that's why I wanted to say this, Dr. Alkanawi, I saw the timeline of your organization in 20, 25 years, how you build from one hospital, this network of hospitals and these different levels of care. And then you went into training and capacity building, and then you went into digital fully. I was impressed reading about this centralized electronic medical record, and then also the app, the patient portal, that can have everything in their hand. Because yes, of course, you will expect this in Europe or perhaps in North America, but countries like ours, my country is also an oil exporter, not as big as yours, but to use those resources on this different path for development that I'm saying, that's the answer. And the COVID, yes, indeed, can be seen as a very humongous challenge, because it is, but it is also an opportunity. It's also an opportunity to leverage technology, to understand that, yes, the user somehow loses a little privacy, but it's about trust. If the citizen trusts the government, as I can see is the case in Saudi, indeed, things are easier. The citizen itself, because it's voluntary, as Patricia told us before, for instance, in these contact tracing apps, they want to do it because they trust the government, that they believe that this is for the common good in a society. So it's a different path for development. Thank you, Danny, for putting this together. Fascinating conversation on how technology, and particularly digital health, can make a difference in the middle of this pandemic and beyond. Back to you, Danny.
Thank you, Alex. And as we're slightly over time, my apologies for that. But I would like to thank our excellent speakers for today. I think it's been a really interesting discussion. Dr. Patricia Ndumi from the WHO and Dr. Bandar Alkanawi. As always, my colleagues here, I'd like to thank as well Alex and Mrs. Julia Gemth from here at HQ. And finally, a big thank you to all of our participants for joining us today. And please don't forget to join us next week at the same time for our next session on the subject of responsible AI for health. And I wish you all a very pleasant day. Thank you and goodbye.
Thank you. Bye-bye.